Alright guys, we're going to do a mobilization with movement of the thoracic spine. Again, one of my favorites to do with a patient that comes in with some impingement, maybe even some rotator cuff pathology, where you know that they probably have some of that sick scapula, but that thoracic spine immobility is directly correlating to that inability for them to really move that arm in space. So this one is aimed at to improve flexion and extension. At this point, if we're applying the force and thinking that we're going to apply an anterior force with a cranial glide to the superior vertebrae, we're gapping between that superior vertebrae and the inferior vertebrae, really those facet joints that are contacting one another. So if I'm improving sliding and gliding, I'm going to improve flexion and extension if I improve that slide and glide. And remember, those are plane joints, so there's not really a lot of convexity or concavity. So with that, we're really going to show improvement. Again, always, let's do our comparable sign. So let's check Jenny out. So I'm going to have Jenny tuck her hands. She's going to lace her hands between her neck, tuck her elbows in. So this is important because we want to try to isolate out that thoracic spine, and then she's going to tuck down towards her belt. If I let Jenny go, she'd show us a lot in that lumbar spine, but I really just want to see what's going on in thoracic spine. You guys start to see not a lot of blocked, not a lot of segmental movement. That tells us a story about Jenny, and remember, we need segmental movement for really a healthy spine. All right, so now we're going to have Jenny keep those elbows locked in, come all the way up into extension. Jenny's not really getting much. And so we see that she fulcrums here, so I'm going to think, man, she's probably restricted into this area, and now I do a visual inspection and confirm that. So Jenny's going to go with me. That's one of the best things about mobilization with movement, is it's a very interactive patient and therapist type of scenario, plus we're retraining the brain at the same time. So a lot of the studies support that we're doing neuromuscular re-education at the same time. So with Jenny, I've got to get in close. If you guys are way out away, you're going to put a lot of stress on your body. So that's number one advice. You got to get in close. I'm going to start low where Jenny needs it. I'm going to get my hand ready. So this time I'm using my hypothenar eminence and my thenar eminence, using kind of that whole pad of my hand to drive in and upwards. So Jenny's going to start low, so we want to prep into the system, and as she comes into extension, I'm going to give her a little bit of that mobilization, and I'm going to be careful not to crank on her shoulders up above. I'm just using that as a light stabilization and a light fulcrum. I move up and down the spine just to try to get as much of that segmental mobility. Again, if you find that point of restriction, you can come back to that, work that a little bit more. You don't need a lot, so do 10 reps, and then you want to recheck, make sure that your efforts are really, really trying to make a difference. Good. And Jenny was okay. She wasn't giving me any cues that she wasn't throughout that, so she's going to tuck down towards her belt. Any change there, Jenny?
Yeah, less of a pull on my right side.
Good, yeah, so she was feeling a lot, strong pull in here. Good, and then come up all the way as much as you can. So we see a little bit less, she's getting a little bit more motion. And what we really want to say, how does that feel, Jenny?
It feels fine, yeah.
No pain. No pain, good. And before she had some fulcruming pain right in here, so we're showing some improvement. I'd go back again because we showed some improvement with that, and do it again. So working up to 3 sets if she continues to gain range of motion through that. Okay guys, have fun with it, try it out.